Hi, my name is Samantha Franzen. I am a graduate nurse practitioner student at Concordia University. I want to talk to you about the bill, H.R. 1155. The bill was created to amend Title 18 of the Social Security Act to allow physician assistants, nurse practitioners, and clinical nurse specialists to supervise cardiac, intensive cardiac, and pulmonary rehabilitation programs. This is a very important issue because these programs are crucial to patient recovery and success, but the current policy limits patient access in rural and urban settings. I encourage you to support this bill, and as I go through this presentation, I will discuss more detail, but ultimately we want to help patients nationwide have access to the care they need. This bill was introduced to the 115th United States Congress House of Representatives by Representative Lynn Jenkins on February 16, 2017. It is co-sponsored by at least 50 other bipartisan representatives. The related bill for this is S. 1361 that was introduced into the Senate in June of 2017. Since the bill's introduction in February, it has been referred to the Committee of Energy and Commerce, as well as the Committee of Ways and Means. From that point, it has been referred to the Subcommittee of Health. The major issue and reason for the creation of this bill is that only physicians can supervise cardiac and pulmonary rehab services, and they must be within walking distance at all times of the program to be reimbursed by Medicare. Cardiac and pulmonary rehab are pertinent to patient recovery, but the current policy limits the accessibility of the program in rural and urban settings. Many patients, as a result, are not compliant and have further complications due to the lack of access and the costs that they incur. A little bit more background and history. Cardiac and pulmonary rehabilitation are a medically supervised exercise training program. They provide counseling and education, and they have proven that they decrease morbidity and mortality. Many healthcare providers believe it's actually a key tool for patients' recovery. In 1 year, 1 million people will have acute MI events, and of those, only 30% participate in programs. Medicare Improvements for Patients and Providers Act from 2008 helped to establish cardiac and pulmonary rehab as long as a physician who serves as a medical director ensures the program safe, comprehensive, cost-effective, and medically appropriate. This same act also requires that direct physician supervision be required for each session. In 2010, federal regulations changed to allow non-physician providers, or in the future, NPPs, to serve as direct physician supervision in many outpatient and hospital settings, except cardiac and pulmonary rehab. The Center for Medicare and Medicaid still require that legislation change the law before they will acknowledge NPPs to supervise cardiac and pulmonary rehab. Overall, this results in a lack of resources and programs available. This bill has been previously introduced in 2015 but did not have success. The summary of the bill, ultimately the purpose is to amend the Social Security Act, allowing NPPs to supervise the cardiac and pulmonary rehabilitation programs. The intent is to expand growth and access to the program in urban and rural settings, ultimately lower costs, and increase patient participation. If the bill were to pass, some of the unintended consequences that we would see can be positive. Ultimately, a decrease in hospital admission rates and readmission rates, a decrease in mortality rates. Studies have shown that patients who attend 25 or more sessions had a 20% lower 5-year mortality rate than those who did not. Using nurse practitioners can also lower healthcare costs by 20%. The other aspect we would see is organizations may have to invest more money for new spaces and facilities to help the programs grow. When doing more research on this bill, there's no fiscal estimate available at this time, but that can always be ongoing. The key stakeholders in this bill are bountiful, actually, but some that I pointed out are American College of Cardiology. They support a fully prepared cardiac team. They want everyone working to their fullest ability, and that includes nurse practitioners, physician assistants, CNSs, everyone kind of doing their job as best they can do to their ability will allow them to see more patients. So they're in support of this bill. In addition, we see the American Association of Cardiovascular and Pulmonary Rehab, the American Heart Association, and other allies that I have listed here include the American Association of Nurse Practitioners as well as physician assistants. On the other hand, Centers for Medicare and Medicaid Services are opposed to the bill. Just based on the language used in the MIPA Act from 2008 and the definition of physician, they do not permit NPPs to fill this role in that capacity. In order to include non-physician providers, the language of the programs need to be revised. Ultimately, as a graduate student of Concordia and a baccalaureate prepared registered nurse, I strongly support the passing of Bill H.R. 1155. These programs have proven success in preventing hospital admissions, patient recovery, and overall decrease in mortality rates. It is a key component to patient care and success, but the lack of access plays a detrimental role in patient compliance. Allowing non-physician providers to provide and supervise these programs would increase accessibility in urban and rural settings and ultimately lower costs. This is a widely supported bill by a variety of associations that are all focused on providing the best patient care. Thank you.